Morning, everybody. My name is Rob DeLetis, the Director of ERP Therapy at BlueSky Behavioral Health. We're going to start a webinar regarding exposure response prevention. It is a different approach that we've developed here at BlueSky to help the clients deal with stuff, their addictions. So most people, when they come to treatment, don't have, let me go to that. Most people don't come to treatment thinking that they're going to see some kind of alcohol, pills, more alcohol, crack, cutting. So I developed ERP sessions for drug and alcohol and self-destructive behaviors. ERP has been around for 40 years, mainly used for people with obsessive compulsive disorders and phobias. So when clients come to my office and I talk about ERP, I talk about this. Hey, are you afraid of spiders? Hypothetically. If they are, their pulse goes up. They start squirming a little bit. And if you eventually see a spider, you're going to have some more difficulties and reactions behaviorally. So what I've developed is a procedure to do the same exact thing. I take the proven ERP theory and developed it for drug and alcohol addiction. So again, I expose clients to their drug of choice, simulated drugs of choice. And over the next 45, 50 minutes, you're going to see different things about the ERP. I'm going to go over an ERP session. I'm going to talk about the rationale, the theory, the approaches of it all. And you're going to know how to run a session to help the clients do stuff. The reality of addiction in the world is you're going to be exposed to the triggers, the sights, the sounds, the smells. So what the ERP sessions do is exactly that. Give a client an opportunity to be exposed to it. So you're going to see all these things. We're going to talk about things. Again, like Harley said earlier, if you guys have any questions, type them in. I will answer them as we go along, and we will go from there. Let's do it. This is a quote I found on addiction that kind of sums a lot up. It stuck with me years ago. I found it like 15 years ago, and it's actually very true to this day. Most of the clients understand it. They get it. They have all these different theories regarding their love of addictions or drugs of choice and or self-destructive behaviors. So the program I developed here at BlueSky is based on a whole different bunch of modalities: harm reduction, narrative interventions, motivational interviewing. And it's actually a very different and unique approach that we've done here. So again, exposure response prevention is a behavioral therapy technique mainly used for obsessive compulsive disorders and phobias. Like I said earlier, most people do not expect to come here and see their drug of choice because, again, this is an instant rapport builder. Clients, my office is full of beer, bongs, booze, a safe full of stuff. And again, showing a client a bottle going like this, clients are automatically on edge, triggered. They truly have their attention as soon as I show them anything or even talk about it. So during this whole session that I have with them, I show them the copies of the book Kill the Craving, which you're going to see in a little bit. And that's based on the whole ERP. What I basically talk about is triggers. And during these sessions, which are optional at the treatment here, they are going to be exposed to a whole bunch of stimuli. They see things, touch the bottles, smell the bottles. They hear things. The only thing they're not going to do is taste it. So vocabulary words we talk about here, we talked about that already. Cognitive scripts. What the cognitive scripts are, and I'll go more into these in detail a little later. What they are 9 positive statements of what you can accomplish when you walk away. And 9 negative things have occurred because of your self-destructive behaviors or your addiction. Individualized for the client. And again, I'll go over these a little later because this is the meat and potatoes of the ERP. Exposing people to their drugs of choice or the simulated drugs of choice. That's not it. It's part of it. The cognitive scripts are the main part. And we're going to spend some time on these. Operant conditioning, we'll hit up in a minute. Responding condition, same thing. Stimuli, positive reinforcement, we'll hit those up in a few. So basically, the example I use regarding the ERP, I tell people, if I grew up with somebody listening to Bob Marley and smoking pot, and they are a trigger, what I would do is put a client's face or the picture of the person they smoked with on the desk. I will put on Bob Marley. They have all these stimuli in their head that they associate with using and doing things. In real life, I go to an Italian restaurant. As soon as I smell the sauce, in my head, it reminds me of grandma. Good stuff and a great meal. I love it. So it brings back these really cool things in my head of like, nice. The clients have the same kind of stimuli in their head regarding different things. People in the past have done drugs and done things. They believe that the rewards. If I smell grandma's sauce, that means I know I'm going to have a really good meal coming on. People in the past with drug and alcohol, they see the drugs, they do things, rewards, escape the feelings, escape the thoughts, don't want to deal with stuff. It's a reward, punishment. I feel bad, therefore I'm going to use and kind of beat myself even more. Operant learning. Cue exposure, sum it all up, I use this. There's a quote on it. Hopefully it's coming up now. Here it is. So I found this in the book, Addictive Behavior Cue Exposure, Theory and Practice. Really great book. Highly recommend it. So what this guy did, he was sitting there talking to somebody, one of his clients, and during the conversation, he just opened his drawer, reached up, pulled out a bottle, and the client's automatic response was this. That's what he wanted. Why? Because he's so ingrained. This equals this. And a really good book, like I said. And it kind of talks about cue exposure, which we're going to go over and do things. If I sit there and just shake a bottle or show somebody a pipe, they're going to squirm. They're going to get used to it. They're going to just kind of go for it. And it's intense. And I'm going to tell you, even the ERP session, when we talk about it with the clients, it is the most intense thing somebody can do. But we'll get into that a little bit as well. Session expectations. Over the years, I've done probably 13,000 ERP sessions, and these are the things that have occurred during sessions regarding the clients. And obviously, being exposed to stuff the first few times, you're going to get a lot of this. And after a while, the behaviors or the session expectations go down, and they get more used to it. So if you look at this, shaking, eager to hold the paraphernalia, automatically grabbing it. If someone comes up to me and says, Rob, let's go do ERP right now, I always think, why? What's going on? What's happening with them? Why do they want to do this right now? The sniffling. There was a guy back in the day who did ERP with, and I'm doing ERP with him for cocaine. All of a sudden he goes, and he starts sniffling. And I didn't really catch that right away. I thought, all right, maybe he has a cold. After the session, I asked him, do you have a cold? He goes, no. Okay. So the next session, we did another one, and we started doing ERP for cocaine, and he goes and starts sniffling again. He was totally unaware. I go, so-and-so, do you have a cold? He goes, no. Why? You're sniffling. So at the end of the session, I pointed out to him, and his brain is so ingrained with cocaine equals that he had the drip down the back of his throat, like people do cocaine. He was sniffling, totally unaware of it. So this brain is the most powerful thing. And he associated with the lines of cocaine with the sniffing, the snorting, the drip in the back of his throat. And he was totally unaware of it. It was amazing. Stressful events from the day. There was a woman who I was doing ERP with for cocaine again. And she sat there. We cut up some lines of simulated coke. She had the straw or dollar bill, and she went down like this, like she was pretending to going to use it. And I stopped her. I go, what's the problem? Well, today was her birthday, so she wanted to celebrate. So of the 13,000 sessions that I've done thus far, one guy 17 years ago took a hit of my pot, and that was the last time somebody actually took any of my stuff. And it's amazing because, again, if somebody really wanted to sit in front of me and have this, like right here, it's real easy to go like that. But again, most of the people who are here don't want to do it, and they want to get help and do something different. So the expectations you see here, restlessness, fidgety, crying. There's one guy who every time I connected the cognitive scripts with his family, negative or positive, he would start crying. And it made it very impactful. So that's why the cognitive scripts are tailored for the client themselves to deal with all of the things. A lot of the clients ask, are the drugs real? Well, it doesn't really matter if they are or not, because again, 99% of the time, if I'm doing ERP with somebody and I show them the paraphernalia, I'll take their pulse beforehand. And I'll do, a little routine of calming people down. Then I'll show them pictures, or I'll bring out this and go like that. 100% of the time, people's pulse go up. So instead of me saying to you, oh, you're an addict, this is what you're supposed to do, I say, explain to me why your pulse went up. So if you show people who are not in recovery or do not have a problem with pills, nothing's really going to happen. Their pulse might go up 1 or 2 points, but I've done this and people's pulse have gone up like 15, 20 points. So instead of me saying you're an addict or you're an alcoholic because I don't like the labels, explain to me why your pulse went up. Manipulative behaviors. Come on, Rob. Hey, turn your back for a second, Rob. Hey, let me see what I can do. The whole thing about the ERP sessions, it's about safety, health, making sure that the clients have this sense of that I'm in control, and I do. Because again, it's about health and safety number one. So if somebody's saying, come on, Rob, let's go do ERP, or hey, Rob, I dropped something, can you go get it? Because again, if they have the pills in their hand like this, all they have to do is go like that. So a lot of the stuff that I talk about to clients is if somebody takes pills, I'll ask them, or has a history of substance abuse with, opiates, whatever. If you ever have your stomach pumped, and they go, yeah, it's like, yeah, I bet that sucks. And they go, well, would you do it? Pump my stomach? I go, I don't know. And the reality is, if somebody takes some of my booze, I'm going to stop them. But the reality is, again, one time in 13,000 sessions has somebody done something. So the thing in my head the most is the last one I'm going to pull up right now. Expectations, the worst. That somebody takes my booze, runs on my office, runs down the road, and starts drinking. And the reality is most people are not going to come to a session with me if they're having one of those bad days and life is, crappy, their parents suck, courts suck, and come in to say, oh, Rob's got a bottle of booze in his office, let's go get that. There's a lot more than that built up. So again, this is intense, truly intense, not only for me, but for the clients. Again, I give them the sense that I'm in control and it's safety and things are going to be good because I got their backs and things are not going to be aren't going to be problems. So if there's any questions thus far, let me know. Harley will tell me them. And let's continue with this. So the basic procedure, they come in, they meet with me. The first session is a full rundown of the rationale, reasons, and step-by-step instructions of what's going to happen during a session, or at least there's a 41-step procedure that I came up with that whoever does ERP, they're trained in ERP, they will come and do these 41 steps the same exact way. So they come in during the session too. I'll do a full drug history. I'll find out what they want to do for ERP, why they want to do our ERP. I'll teach them how to do deep breathing, body scan. I'll take their pulse. I'll role play what's going to happen. Again, expectations like you saw on the previous slide. I don't know what's going to happen until the client actually gets in my office, but at least the first session, deep breathing, body scan. So somebody will come in, I'll take their pulse, I'll get a baseline and show them what's going on and give them a 41-step procedure. I explain it to them. I don't think they get it right away because, again, all they're thinking about is this and what's going on and how I can do things and how I can get away with it from Rob because he's not the smartest guy around. But again, it's a matter of safety. So I want to spend some time on this because these are really, really important. The cotton scripts are the main part of the exposure response therapy that truly, I can't stress this enough because the clients have these individualized statements, 9 positive, like I said before, and 9 negatives. And this is how we get the full impact of the ERP. A lot of the clients I deal with can come up with 1,000 negative things that have happened. Let it be withdrawal, hospitalization, loss of kids, jail, suicidal ideations, court stuff, accidents. But again, when you talk to them about positives, it's difficult for them to find out what's going on and how they can look at positives regarding their treatment or their addictions or their family or the guilt, the shame, and all that stuff. So basically what we do, here's some examples coming up in a second. I swear they're coming up. One more. Here's some examples that I developed over the years for people. And again, if there's one, positive ones start, if I walk away, or I will, blank. Negative ones, remember, blank. And again, these are really not for me. These are for the clients. I don't have to know what they mean. There have been people in the past who would actually come up with one-word responses. No offense. Newark. And that meant to this person, wrong place, wrong time, bad things. And I make these either really general, like number 2, remember the high-risk situations I faced when I was drunk or high, all the way to specific. Remember the times I prostituted myself to get my drugs. So if the client wants to be specific, it's totally up to them. If they want to be generic, because I don't need to know what they've all done, they do. And again, these conjure up emotions and thoughts and feelings that a lot of people have hidden for a long time. There's one guy recently who came here for an addiction to crack. So he thought he was strong because he was clean for like 45 days already before he got here. And of course, he's never been exposed to it. So I talked to him about ERP, and he was like, I can do this. I want to do this. I want to see how I react. And we set up the cognitive scripts, first session, talked about some things. I was hesitant a little bit because I didn't know how strong he was going to be and how reactive he would be. So I said, all right, let's do it. We did it. And the first session, he got so emotional and just sat there and cried. And this is a gentleman who has been in treatment for years, the wall of guilt, shame. He's been in and out of jail. He had some legal charges pending, and he's been AA. And he was talking here, not here. Once we did the ERP, the wall came down. He was so insightful, so connected. He connected the heart and the soul and the brain together. And this just brought the wall down, and he was emotional, and he was crying. And for the next couple of days, he was truly much more real. Because in the past, he would just talk from his brain and tell me what I want to hear and quote NA and do all these other things. And it's like, be real. And then once he started doing this, he realized he wasn't as strong as he thought. Because a lot of clients, when they're in treatment or they are away for 30 days, 60 days, 90 days, they get the false sense, look at me, I'm strong. But people don't put themselves in the situation of being, I'll say, tested. And what it is if you look at the reality of our lives, what's the first question they ask you on a restaurant? What do you want to drink? Technically, I can never watch the Super Bowl if I have the label of an alcoholic because every other commercial is about Bud or Bud Light. If you go on an airplane and go across seas or across the ocean to England or whatever, well, they ask you, how many bottles of wine you want, Mr. DeLetis? Travel internationally, it's like, what do you want? How many bottles you want? Difficult. So if you put yourself in a situation like here, and we talk about the cognitive scripts, we do ERP, again, you're going to hear this a lot today. This is not a cure-all, but this is a combination with 12 steps therapy, medication, nutrition, exercise, holistic, balance, fun, different path, different piece of the puzzle that gives people a different idea. Like this one gentleman I just spoke about regarding the crack addiction. Again, he thought he was strong enough and he was ready to go home, but he never put himself in the situation. If you ask one of your clients, how many times you sat there with your drug of choice and never did it? The answer is going to be 0. However, when they do the sessions, they're going to sit there and hold it and see it and all those other things. So again, intense. The cognitive scripts also for the gentleman who did ERP with crack. They're about most of them were about his family and gaining some self-control and gaining some independence and not losing his freedom again. And again, impactful that he was so emotional for the first 3 or 4 times that we did it, the wall came down. And then he was strong enough. And his quote was, I really thought I was strong enough. It goes back to that quote I put in the beginning where the gentleman just pulled out the bottle and the guy went for it. Their brains are automatically wired that way to do that. So this gives people like a fighting chance and to be exposed to something before they go back into the world. And the world is easy. You walk out of a treatment center, what can you do? You can go to a bar, you can go to a restaurant, you can go get drugs, but it's a matter of looking at these and thinking about these cognitive scripts and develop them over and over again. So the objective of a ERP session is to develop these cognitive scripts, say them over and over and over and over and over and over in one session. So it's 18 times, 6 times you're going to hear them. And the reality is those cognitive scripts are going to eventually be up here. So if I can break somebody for the automatic response of just taking that bottle and going like this and thinking about I want and deserve a good future for myself, I'll be a positive role model for my children, whatever it is. If I can make them break the automatic response, they win. And again, not a cure-all, but a different approach to something that's intense and the reality of what they've done. And the first, well, we'll get that in a second. Let me go back. Oh, sorry. How do I go the other way? So the first session, first and second session, I find out, it's called the ERP face sheet. We talk about what drug they used, what paraphernalia I need, what kind of music I listen to, what kind of triggers do I need to set up. Let it be music, let it be sights, let it be sounds, let it be pictures of drugs. I've also used the computer in the past to set people up with different scenarios. There's a guy who used in the city all the time. I'd put up pictures of city wherever he was. Let it be Brooklyn, Manhattan, Jersey, wherever, just to get him the feel for what's going on. Music, whatever music they associate with using, I put on, and I have them bring it. If I don't have it on my, I date myself, iPod or phone, then they bring it in and they discuss it and we do things. All the paraphernalia that you see, I have. Whatever I need to do, I get. If it's a mirror, if it's a dollar bill for cocaine, if it's a crack pipe, if it's, whatever I need to do, I will get it. I try to make it more as realistic as possible for the client because that's what it's all about. It's not so much about what I want, it's what they want and what triggers their thoughts and feelings and everything else. So again, intense. Let's go back. So on here, you're going to see pictures of different sessions. So I'm going to go over what an ERP session kind of looks like. Session one, you come meet with me, reason, rationale, develop the cognitive scripts. And what I do to make sure that the client is into this and see how much energy they want to put into it, I will have them develop the cognitive scripts first and then bring them to me. So if by some chance somebody's like hesitant about getting it done right away, it takes them like, 4 or 5 days. I won't ask them, hey, so-and-so, can I have those cognitive scripts or how you doing with those? I wait for them because I want to see how much energy they want to put into their recovery. We all know that if I work harder than them, it's a problem. So I give them examples of the cognitive scripts. They develop them. Session two might come in and talk to me and let's finalize the cognitive scripts. I go over the rationale and reason one more time. I go over the 41 steps. I make sure I have all the paraphernalia. I make sure I have all of the music and everything else ready for them to go. So the pictures you see on the screen here are examples of different levels. So level one is they come in my office, they do some deep breathing, body scan. I take their pulse, and then I give them, craving rating, a scale of 0 to 10. How bad are you craving right now? And there's a set list of what 0 to 10 is, and they pick, and we go from there. And I ask them the reason they're doing ERP. I don't want to hear like, well, because I want to get clean. Why are we doing ERP? I want to be stronger. I want to get back to my life. I want to get my kids back. That's why I'm doing ERP. I'm tired of going to rehab. Whatever reason they come up with that's actually legit. Then we go into the ERP session. Level one. Paraphernalia is out on the table. Nothing. So it might just be this. And what I do for level one is I recite the cognitive scripts. At that point, they're not going to hear me. They're not going to see anything. They're going to see this or just drop the pills or the bottle, whatever it is. They're not going to know I'm even there. So I'm reciting the cognitive scripts, all 18 to them. And at the end, when I'm done with the 18, I take the craving rating and pulse one more time. And I ask, would you like to continue? Yes. Level two, you're going to recite the cognitive scripts as I say them. And what I want you to do is either hold the bottle, and you can hold it like this. If you want to hold it capped, great. If you don't want to hold it, you don't have to. Your choice. So as I go recite the cognitive scripts, they repeat them. So they're holding this. Or I'll pour a shot glass. I'll have it right there on the table. So they finish all 18 cognitive scripts, craving rating pulse one more time. Your pulse is this. Would you like to continue? Yes. Level three. You recite the cognitive scripts. You remember verbatim or from memory while you're holding the bottle. Either like this or just kind of smelling it now, because now you can smell the whole alcohol coming up. Or you hold the crack pipe, or you hold the razor, or you hold whatever's in front of you pill-wise. So they recite the cognitive scripts from memory. So say they get 5 out of 18. What I will do is give them the other 13 they did not get with certain words. So the one was like, I'll be the father my kid deserves. I'll say father, and hopefully they'll get, I'll be the father my kids deserve. Interval 18, craving rating pulse one more time. Your pulse is. And we go to level 4, which is the last level. Would you like to continue? Yes. Level 4 is repeat level 3. So throughout the different levels, you can see different levels of exposure. So level 1, paraphernalia is on the table. Level 2, I'll prepare. I'll cut up lines of Coke. I'll pour a shot of whiskey or whatever it is. I'll put the pills out on the table. Not in their hands, just on the table. And just kind of get all that stuff prepared and doing things. I'll roll joints. I'll cook up heroin. I'll put all the stuff on the table just to get a feel for it. Paraphernalia. Level 3, again, if they want to hold it, that's fine. If you don't want to, no problem. The gentleman who I did ERP with recently for crack, he had no desire to look at the pipe, look at the crack, and hold it the first 2 sessions. After that, he goes, I'll hold the crack pipe. And you could just see the sweat coming down, the pulse going up, and everything, because he was so afraid. He never wanted to see the crack until like the 5th session. So I have a little vial of crack, but he didn't want to see it until then, because again, he was so afraid of what was going on and what was going to happen that he was ill prepared. But he did it, and he did really well. So once the session is over, level 4, I put the paraphernalia away. So if they have the shot glass of, say, whatever, Jack Daniels, I'll put all the paraphernalia away. The shot glass will be on the table, and I'll say, okay, can you do me a favor? Can you pick up the shot glass, walk with me, and dump it down the drain? And they do. And then, or take the syringe of heroin, put it, squirt it into the garbage. Take the pills, put it back in the bottle, give it back to me. And it is the weirdest thing that people are like, what do you want me to do? I want you to take the shot glass, go to the sink with me, dump it down. Again, one time, 13,000 sessions, somebody, I got burned. Haven't happened yet in 17 years. So even with the clients picking up that shot glass and walking 25 feet to the sink and dumping it down the drain, or taking the pills, put it in there, you ought to just see their heads. It's like, good angel, devil, angel, devil. This is good. This is bad. This is good. Again, so we sit back down, we do some relaxation, we do some body scan, we decompress. They do. And we sit there and ask them questions. All right, what did you notice about you today? And they'll figure out what they noticed inside their body. Let it be shaking, let it be, I wasn't connected to the craving, the cognitive scripts. I was truly in my head. I went someplace in my head, I wasn't sure. So what I'll have them do is talk about what they've noticed, and then what I do is I point out what I noticed. So when you talk about those expectations from earlier, those are things that I've seen over the years, and I pointed out to them. If I go back to the talking when I had about that gentleman who did the sniffling, once I pointed out to him after the 2nd or 3rd session that he was doing it, all I had to do during the session was go like this. And he would go, I'm doing it again, aren't I? Yep. And at that point, he caught himself and was truly aware of what's happening. So the objective is for the ERP session is to have them aware of what is going on internally up here as well in their heart, and what's going on with their legs, shaking, anxiety, nervousness, and self-empower them in a way where there's like, look at me, I'm strong. So I ask them these questions. The last question I ask is, how many times you sat there with your drug of choice and never done it? And they'll go, never. No, come on, how many? Never, 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 never. You just did it. First session. And the light bulb goes on. It's like, yeah, I just did it. And again, angel, devil, because they're so used to the automatic response of this. And I just proved to them, or they proved to themselves with a little help, how strong they really are. Because people over the years have talked about, you're not strong enough. Your addiction's too intense. You can't do this. You just proved it that you're stronger than your addiction today. But what I used to do, there's a guy who was doing ERP sessions with me, and he walked up to me and goes, hey, Rob, so-and-so's having a bad day, and they're having a bad therapy session or whatever it is. And I go, okay, go do ERP with them. And the guy would look at me like, no, why? Just go do it. So he did it, and he would come back and go, I said, how things go? Fine, no problems. He goes, why'd you want me to do that? Because if somebody's in recovery or here for addiction, and they're having a bad day and their life sucks and court sucks and everything else is falling apart, imagine being there with your drug of choice in your hand and not doing it. How great is that? Again, it took me a while because the natural instinct is bad day, let's get rid of things. I don't want to feel, I don't want to deal. So what I do is I escape. So if we can get somebody in a session during a bad day and doing things, wow, they win. So at the end of the session, before they leave my office, another craving rating, another pulse, see how you're doing. And then what are you going to do when you walk out this door? When, not if, when you have cravings. Because I want to make sure that they have a plan to make sure they're okay. If it's go to AA, call somebody. Who are you going to call? I'm going to call my sponsor. I'm going to call my family. I'm going to call you, Rob. Well, you've never called me before, so don't tell me what I want to hear. Tell me what you're really going to do. I'm going to go to the gym. I'm going to exercise. I'm going to go, take care of myself. I'm going to go deep breathe. I'm going to recite the cognitive scripts, whatever it is. So at least I know they have a plan when they walk out, and they have some kind of idea of what they're going to do with their life and their recovery. So a lot of the things about them is giving them the control of when you walk out my office, what are you going to do? And I'm going to say this again, the first 4 or 5 sessions are probably the most intense. The first session is I never know what to expect. If you go back to that slide where it says the worst, that's the worst thing. I don't know what's going to happen, but I always think somebody's going to take my stuff and run out my door. And thank God it hasn't happened yet, but I'm pretty good with it. There's also times I would not do ERP with people. If somebody is psychotic, actively psychotic, not even close. We're not, until you get stable, no. What I do ERP with, alcohol, coke, crack, marijuana, heroin, pills, designer drugs, cutting, gambling, sex, eating disorders, you name it, cigarettes. I can pretty much do it. Developed by the cognitive scripts, developed with whatever paraphernalia I need. I've learned to, be creative and help the clients out the best of my abilities. Again, it's about what's best for them and what's good for them. Any questions? Feel free. Let Harley know. Haven't heard any yet. What you see now is called the craving wave. I'm going to go over a quick explanation of this. On the bell curve, A is life is good, wonderful, and grand. B is where the clients of mine arbitrarily have decided too much. So they cut themselves off by doing drugs, by gambling, by sex, by whatever it is. And they've learned over the years, once they get to the point of B, I can't deal with it anymore. I must use, I must cut, I must do something. Because they've never given them the chance to go to C, which is the pinnacle, because they think they're going to explode. Because from B to C, intense. And B is arbitrarily on this graph right here. It could be like real close to A, and majority of the time it is. So once I do the ERPs with clients, they actually get to B, have the drug of choice right in front of them, and don't use. And they feel the feelings from B to C. And they get to that pinnacle on C and start breathing and coming down. And what happens is after session after session after session after session, B arbitrarily moves over closer to D. And the impact and the stressors they can deal with is so much more. Because again, they've never gotten to the point of actually doing something and making sure they can get to do it without exploding. So again, this is one of the classes that I run in the groups at BlueSky here, part of the drug program, and they learn all these things and learn about taking care of themselves and learn how to address the triggers and all these other fun stuff that they are going to be exposed to in the world. That's just to give you another explanation. So it's cool. One more. In the book, Kill the Craving, you're going to find all these assessments and things we've developed. The one I like the most is the financial loss inventory. Great group. In the book, you'll find out you have to add up how much money you spend on treatment. Let it be insurance companies, let it be families, let it be yourself, let it be whatever. And pardon the pun, it's a very sobering experience because nobody has really sat down and talked to them about things. And it's like, what have you lost financially? What have you lost emotionally, which is the one right above it, the non-dollar cost. There's a whole bunch of different exercises we do from the book that are just like intense and gets people to think. We talk about the path and recovery. Obviously, you're going to hear it again. ERP is not a cure-all. but in combination with a whole bunch of things, including the support groups you see on the list, here it is. Over the years, when I've done trainings and seminars and conferences all over the place, people give me that. This is very interesting, very kind of unique, but it goes against the 12-step, what our program is all about, what we do. Okay, but again, it's really not about this. It's about taking care of the clients and making sure the clients have a shot. And then what I tell people is, if you go to AA or NA and you talk about what I do, okay, they're not going to get it, they don't understand it, or they're not as open-minded. But if you look at the path of what I have versus the path of support groups, the outcome is exactly the same. I want people to be sane, sober, and happy. So does AA, so does NA, so do all these other support groups. The path is truly a different approach, but it's the same kind of outlook and mindset of things. So there's a woman, probably about 55 years old, who was going to AA, and she talked to me about ERP, and she was ready to do it. And she comes back to me and says, my sponsor said you should be shot. That's a little harsh, but so that means you don't want to do ERP? She goes, yes, I don't. And that's fine. And again, conferences and seminars, nobody's really threatened harm to me. But once I talk about the approach, and it's a different approach, a unique approach, an intent approach, they're understandable and they get it. Again, the old school way, whatever works. I tell people, if my pen keeps you clean, take the pen. Because in combination with therapy, medication, nutrition, exercise, balance, fun, whatever, cool. And again, support groups have been around for a year. They're a great place for support. They're a great place to meet people who get it, understand it. Excellent. So it's a matter of whatever's going to work for the client. And when I talk about these approaches to things, even with support groups, if somebody says to me, Rob, I want to go to AA or NA, okay, whose idea was it? Because if you're doing it just because your parents said or your therapist said, what does that mean? Do it because you want to. And I've had people who have been doing ERP alone with no support groups. It's whatever works for you. And again, you know you better than I do. So what do you need to do? I'll give you the support. I'll give you the guidance. I'll give you the resources. What do you want? How are you going to do it? Because here at BlueSky, I treat people without the labels. So when I first meet somebody, it's like, hey, I'm Rob. Who are you? Cool. Some things I like, honesty, truth. Some things I don't like, labels. So I don't call anybody an alcoholic. I don't call them their label, their diagnoses. I don't say anything except, hey, whatever your name is. Hi, I'm Rob. That's what I treat people with. And the reality is people are not their behaviors. People are not their addictions. People are not all these big files they have in the courts or the treatment history. A lot of the clients I have here are the most phenomenal, brilliant, creative human beings who are artistic, talented, athletic, all these other really great qualities that they forgot. And my objective here is to show them who they really are instead of not letting their behaviors take over the control of their addiction to define who they are. So it's a different approach we have here, which we should be doing this. So this is what I call the ingredients for success, things I developed over here to help people do things. And there's many, many more, but in combination with these things, ERP, therapy, vocational stuff, fun. When was the last time somebody had fun? Like just, doing things. So we get these, I love going to the Buddhist temple. We take people to the Buddhist temple. This is great. Never been around it. Nice. Expose people to different things of like good times and fun and looking at things in a different way. We have ping pong tournaments. People love them. Chili cook-offs. Whatever it is, whatever it takes for the client to be in the world. That's what it's about. Having some real fun and laughing and just doing things and looking at yourself and what you're doing. Seeking out support. If medication helps, great. Here at BlueSky, I run a substance abuse group at a jail, the local jail. I take people to a prison 5 times a year. You never know. One bad mistake in the recovery world of drinking and driving, you could end up in prison. Do I think it's going to happen? No, but you never know. So the reality of my life is let's show people the reality. Let's show people what's going to happen or could happen if you do these high-risk situations. Because the consequences, intense, impactful, deadly. And we kind of want to stop that. Again, any questions thus far? Excellent. So This is a retrospective analysis of the data we did a while ago. One group did ERP and groups. One group obviously just did groups. So if you look at people who relapsed versus people who did not relapse, ERP in combination with groups, much more helpful. And I think there's another one. This is the better one. We did a follow-up study. People who did ERPs were more likely to be sober at the six months. Retrospective analysis, looking to do a full-scale study. So if anybody would like to do a full-scale study with me, you know where to find me. Because, again, the data was favorable. Things were really good. We also need to go, again, the full-scale study would add the efficacy for this and make sure that people understand how effective this can be as a tool and a different piece of the puzzle to make people much more happier, sober, and sane. So these are different types of groups we have here. I apologize for the big giant protocol slide. We saw substance abuse groups. There's probably 14 different groups throughout the week. There's drug and alcohol counseling sessions with myself weekly. Therapy, most people here meet with people 1 or 2 times a week. Psychiatrist, community support, you name it. And the last one, ERP is optional. Again, it's not for everybody, and I don't always tell people you have to do it. It's what do you want? So this is kind of the protocols we set up. Again, motivational interviewing, harm reduction, nerve interventions, love it. And I also train people from around the United States and doing things on to do ERP. So if you want to be trained and taking the ERP sessions back to your place, I train people, I do seminars, I do conferences, I do a whole bunch of different things taking this back. In the past, I've trained people from, strangely enough, prisons. There were a time like 4 or 5 people were trained from prisons. They would take it back and do this ERP sessions with things. So it's kind of intense. Regarding the trainings, there are certain times I would not do or train people. There was a woman who thought it'd be really kind of fun or interesting or cool to, she had some issues with eating disorder and she conquered them. So she thought it would be good if she could do the ERP sessions and do these with her friends. So I told her no, because it's not about that. It's about doing something that's going to be productive and not just kind of fun. There are certain people, psychologists, therapists, social workers, who if you can't be in control or at least provide a sense of control in the sessions, you're not doing the sessions. And I'll say it, there were times back in the day, I'm doing ERP for self-injurious behaviors with somebody with borderline personality. Whoa. There was a gentleman who was a psychologist, no offense, any psychologist, who came in thinking he was all that, and he's got this under control. So my old coworker and I do trainings, and we sit in on the sessions to make sure that when somebody's being trained, they're protected and safe. So there's a woman who wanted to do ERP with this guy. And I go, all right. So she did ERP with alcohol. So the guy went in with like a light blue shirt, came out totally soaked in sweat because he got played and was totally scared, nervous, tense, totally lost control of the ERP session because this woman just ate him up. And around here, when I talk about the ERP sessions, I am in control of what's going on, and I exude confidence to make sure that the client is okay. So there have been people who, if you can't roll a joint, you're not doing ERP. You're not doing some of this stuff. So if you don't feel confident in your abilities to do things, roll a joint, cook up heroin, cook up crack, or at least put a crack pipe in, multitask. Because again, between the sessions or during the sessions, you have to manage the client, cook up or pour some drug or do some things, make sure they're okay, recite the cognitive scripts, and make sure, oh yeah, they're okay. So multitask, 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 and more multitask. It's intense, not only for the client, like I said, but for the clinician as well. And again, if somebody is not providing that confidence or the safety to make sure the clients are okay, I don't train them. And it's not about that. It's about making sure that the clients are good and they're protected, which is key. Any questions thus far? Why not? If anybody has any more information, there's a website on the bottom, theerptherapy.com. You can check, give me a call. My phone number is right there. I do periodically, I have a Twitter account, ERP Therapy, Twitter. So I post the conferences that I'm going to do from all over the United States. And I have booths and seminars and books and stuff like that. So if you want to learn more information, you can give me a call. You can check out the website. I think there's another slide coming up. Look at that. We have a 2-day training seminar where I train people how to do all these aspects of the ERP. So they'll be officially an ERP certified therapist. They go back and do the ERP sessions with their clients, and they learn everything about it. If people want to come and do the seminar, 2-day seminar, they practice with me, they practice with my clients, they practice with our staff to make sure they get it. And I play a really good client, because if you want to know what to expect, I will show you what to expect. And again, there's certain people I will not train. There's certain people who need to make sure they're okay and safe and okay. And I'll say it again, portray confidence that they're going to do the right thing, which is protect the client and make sure it's safe. So there's kits. Most of the stuff I have is simulated. And again, once I show a crack addict this pipe, I can put anything I want here, make it burn, and they're not going to say one word. In fact, my crack, this is my crack vial, Lifesavers, wintergreen Lifesavers. And not once in 17 years has somebody said, oh my God, it smells like burning sugar, because this is so intense and so into it that, you know, if I show them the paraphernalia and I have a lighter out there and I just flick that bic, they're going to be off to the races. So the kits include all the paraphernalia, videos, instructions, and everything else to go with it as well. So here's some information regarding websites. If you want to check it out, BlueSkyRecovery.com, KillTheCraving.com, ERPTherapy.com. There's a phone number on the bottom. If you want to reach out to me, give me a call. If you want to learn more information or talk more about it, definitely feel free to give me a call. The bottom number right there, 347-672-7199. If there's any questions, this is the time for questions. This webinar is pretty much over, and I'm still waiting for Harley to come in and give me a question, but I don't have any. So if there are any questions, thank you for your time. Thank you for listening. I hope it was informative and impactful will be the key word. Wait, Harley's coming in. You have any questions, Harley? No questions. So again, if you have any information, give me a call. Check out the website and look for ERP therapy and stuff down the line on Twitter. Take care. Have a good day.